Welcome to today's pharmacology quiz on antipsychotic drugs, part of our ongoing pharmacology quiz series. In this video, we'll test your knowledge on medications used to manage schizophrenia, bipolar disorder, and other psychotic conditions. The quiz consists of 10 multiple-choice, scenario-based questions, each designed to challenge your clinical reasoning. Every question comes with 5 options, followed by the correct answer and a clear explanation. There's also a companion video that offers a detailed review of key concepts on antipsychotics. You'll find its link in the description below. So, let's get right into it. Question 1. Mr. Anderson, a 35-year-old man with schizophrenia, presents with acute agitation and auditory hallucinations. He has been on haloperidol for the past 3 months but recently developed tremors, muscle rigidity, and bradykinesia. The clinician suspects drug-induced extrapyramidal symptoms, commonly referred to as EPS, and plans to switch to another agent with a lower risk of these symptoms. Which of the following drugs would be the most appropriate alternative for this patient? Option A, clozapine. Option B, chlorpromazine. Option C, risperidone. Option D, fluphenazine. Option E, haloperidol. The correct answer is option A, clozapine. The explanation is that clozapine is an atypical antipsychotic with minimal risk of extrapyramidal side effects because it has weak dopamine D2 receptor antagonism and strong serotonin 5-HT2A antagonism. It is particularly beneficial for patients who develop EPS on typical antipsychotics like haloperidol. However, clozapine use requires close blood monitoring due to the risk of agranulocytosis. All other listed options, especially the typical agents like haloperidol and fluphenazine, have a much higher risk of EPS. Question 2. Mrs. Clark, a 65-year-old woman with Parkinson's disease, develops psychotic symptoms after being treated with levodopa and carbidopa. She has a past history of depression and hypertension. Which of the following antipsychotic agents is most appropriate for treating her psychosis with minimal worsening of motor symptoms? Option A, clozapine. Option B, haloperidol. Option C, risperidone. Option D, fluphenazine. Option E, olanzapine. The correct answer is option A, clozapine. The explanation is that clozapine is the preferred antipsychotic in patients with Parkinson's disease-related psychosis because it produces minimal interference with dopaminergic transmission in the nigrostriatal pathway. Unlike typical antipsychotics such as haloperidol and fluphenazine, clozapine does not worsen motor symptoms. Risperidone and olanzapine can still cause some degree of extrapyramidal side effects at higher doses. Therefore, clozapine offers the most effective symptom control while preserving motor function. Question 3. Mr. Garcia, a 42-year-old man with bipolar disorder, presents with manic symptoms including rapid speech and irritability. He has a history of lithium use but developed nephrogenic diabetes insipidus. The psychiatrist decides to start an atypical antipsychotic with mood-stabilizing properties. Which of the following agents is most suitable for this patient's acute mania? Option A, olanzapine. Option B, quetiapine. Option C, ziprasidone. Option D, clozapine. Option E, aripiprazole. The correct answer is option E, aripiprazole. The explanation is that aripiprazole is an atypical antipsychotic with partial agonist activity at dopamine D2 receptors and antagonist effects at serotonin 5-HT2A receptors, giving it both antipsychotic and mood-stabilizing effects. It is highly effective in managing acute mania and maintenance therapy for bipolar disorder. Aripiprazole also has a favorable metabolic profile compared with drugs like olanzapine and quetiapine. Clozapine, while effective for treatment-resistant schizophrenia, is not a first-line choice for acute mania due to its side effect profile and monitoring requirements. Question 4. Miss Reynolds, a 28-year-old woman treated with risperidone for schizophrenia, complains of amenorrhea and galactorrhea. Laboratory results show elevated prolactin levels. Which of the following mechanisms best explains these effects? Option A, dopamine D2 receptor blockade in the tuberoinfundibular pathway. Option B, serotonin 5-HT2A receptor antagonism in the limbic system. Option C, muscarinic M1 receptor blockade in the central nervous system. Option D, alpha-adrenergic receptor antagonism in the hypothalamus. Option E, NMDA receptor inhibition in the frontal cortex. The correct answer is option A, dopamine D2 receptor blockade in the tuberoinfundibular pathway. The explanation is that risperidone causes hyperprolactinemia by blocking dopamine D2 receptors in the tuberoinfundibular pathway, where dopamine normally inhibits prolactin secretion. When this pathway is disrupted, prolactin levels rise, leading to clinical effects such as galactorrhea, amenorrhea, and sexual dysfunction. This side effect is more pronounced with risperidone compared to most other atypical antipsychotics. Other receptor mechanisms listed, such as serotonin or muscarinic blockade, do not directly influence prolactin secretion. Question 5. Mr. Henderson, aged 60, with treatment-resistant schizophrenia, has not responded to multiple antipsychotics. He is now being considered for clozapine therapy. Before initiating this drug, the physician must counsel the patient about potentially life-threatening adverse effects and monitoring requirements. Which of the following statements regarding clozapine is incorrect? Option A, it requires baseline and regular blood count monitoring. Option B, it may cause agranulocytosis and seizures. Option C, it is safe in patients with a history of myocarditis. Option D, it has a high risk of weight gain and metabolic syndrome. Option E, it lowers the risk of suicidal behavior in schizophrenia. The correct answer is option C, it is safe in patients with a history of myocarditis. The explanation is that clozapine is actually contraindicated in patients with a history of myocarditis because it can cause life-threatening cardiotoxicity, including myocarditis and cardiomyopathy. This risk makes cardiac monitoring crucial during therapy. While clozapine does indeed require regular blood monitoring for agranulocytosis and carries a risk of seizures and metabolic side effects, it also has the unique benefit of reducing suicidal behavior in patients with schizophrenia. Therefore, the statement that it is safe in myocarditis is incorrect. Question 6. Mrs. Wilson, a 48-year-old woman with major depressive disorder with psychotic features, is receiving haloperidol along with fluoxetine. 2 weeks later, she develops severe muscle rigidity, hyperthermia with a temperature of 40 degrees Celsius, and autonomic instability. Laboratory findings reveal elevated creatine kinase. Which of the following is the most important initial management step? Option A, immediate discontinuation of haloperidol. Option B, start bromocriptine therapy. Option C, begin dantrolene infusion. Option D, administer benzodiazepines. Option E, provide intravenous fluids only. The correct answer is option A, immediate discontinuation of haloperidol. This is because the clinical presentation is consistent with neuroleptic malignant syndrome, a life-threatening reaction to dopamine blockade by antipsychotics such as haloperidol. The most crucial first step in management is immediate discontinuation of the offending drug. Supportive therapy, cooling measures, and hydration should follow, while pharmacologic treatments like dantrolene or bromocriptine may be considered afterward. Prompt recognition and withdrawal of the antipsychotic are key to preventing further deterioration and death. Question 7. Mr. Stevens, a 55-year-old man with type 2 diabetes mellitus, is started on olanzapine for schizophrenia. After 4 months, his fasting glucose rises significantly. Which of the following antipsychotics would be least likely to worsen his metabolic status if switched? Option A, clozapine. Option B, risperidone. Option C, aripiprazole. Option D, olanzapine. Option E, quetiapine. The correct answer is option C, aripiprazole. The explanation is that aripiprazole has the lowest risk of metabolic side effects among atypical antipsychotics. It is associated with minimal weight gain, dyslipidemia, and glucose intolerance compared with agents such as olanzapine and clozapine, which are strongly linked to metabolic syndrome. Risperidone and quetiapine can still cause some metabolic disturbances, though to a lesser extent. Therefore, aripiprazole is the most appropriate choice for a patient with diabetes requiring antipsychotic therapy. Question 8. Mrs. Roberts, a 58-year-old woman with schizophrenia, has been stable on haloperidol for several years. Recently, she developed involuntary lip-smacking and repetitive facial movements. Her psychiatrist considers changing to another antipsychotic with a lower risk of tardive dyskinesia. Which of the following drugs is most appropriate? Option A, clozapine. Option B, haloperidol. Option C, flupentixol. Option D, olanzapine. Option E, zuclopenthixol. The correct answer is option A, clozapine. The explanation is that clozapine is the atypical antipsychotic with the lowest risk of causing or worsening tardive dyskinesia. It is often reserved for treatment-resistant schizophrenia or for patients who develop extrapyramidal side effects from typical agents. Clozapine works differently by weakly blocking dopamine D2 receptors and strongly antagonizing serotonin 5-HT2A receptors. Olanzapine, although an atypical antipsychotic, is not the best option because it carries a higher risk of causing metabolic side effects and still has some potential to induce tardive dyskinesia. Question 9. Mrs. Ellis, a 70-year-old woman, has long-standing schizoaffective disorder treated with chlorpromazine. She now experiences lightheadedness and a syncopal episode. On examination, she is hypotensive with a blood pressure of 88/60 mm of mercury and has ECG evidence of QT prolongation. Which of the following mechanisms best explains her symptoms? Option A, alpha-1 adrenergic receptor blockade. Option B, central dopamine D2 receptor blockade. Option C, histamine H1 receptor blockade. Option D, muscarinic M1 receptor blockade. Option E, serotonin 5-HT2A receptor blockade. The correct answer is option A, alpha-1 adrenergic receptor blockade. The explanation is that chlorpromazine, a low-potency typical antipsychotic, causes orthostatic hypotension and dizziness primarily through alpha-1 adrenergic receptor blockade. This mechanism reduces vascular tone, leading to blood pressure drops upon standing and occasional syncope. Chlorpromazine also prolongs the QT interval, compounding cardiovascular risks. Other receptor blockades, such as H1 or M1, explain sedation or anticholinergic effects but not the hypotension and fainting episodes observed in this case. Question 10. Mr. Foster, a 27-year-old man, has been taking risperidone for schizophrenia. He complains of breast tenderness and galactorrhea. Laboratory results show elevated prolactin levels. All of the following drugs are likely to cause this adverse effect except Option A, haloperidol. Option B, risperidone. Option C, paliperidone. Option D, quetiapine. Option E, amisulpride. The correct answer is option D, quetiapine. The explanation is that quetiapine rarely causes hyperprolactinemia because it has relatively weak dopamine D2 receptor blockade and rapidly dissociates from these receptors. In contrast, haloperidol, risperidone, paliperidone, and amisulpride strongly inhibit D2 receptors in the tuberoinfundibular pathway, leading to increased prolactin release. As a result, patients may experience galactorrhea, gynecomastia, and sexual dysfunction. Quetiapine's receptor profile makes it a safer choice when avoiding prolactin-related side effects is a priority. Conclusion. That wraps up our revision on antipsychotics and the multiple choice quiz we explored together. I hope this session helped reinforce your understanding of the mechanisms, uses, and side effects of these important drugs in clinical practice. For deeper learning, I recommend reviewing Katsung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and consulting the British National Formulary, BNF, for up-to-date prescribing information. All guideline references in this video specifically follow the BNF. Keep up the great work and continue strengthening your pharmacology knowledge. Every bit of progress takes you closer to mastery.